Creaky, squeaky, deep knee ache got you down and out. Maybe it hurts with stairs or pushing off like when you start a run. You just might have chondromalacia. Find out if you do with this active test. What is chondromalacia? In between our joints, there's this cartilage lining. The kneecap has this lining that helps glide across the knee joint, helps provide the clean and smooth lubricated motion we want. Cartilage has few purposes, like helping joints slide and dealing with impact and load. An analogy I like to use is think of a wet sponge. You can smoothly wipe it across the surface when it's nice, new, and squishy. But what about when it's used, old and brittle, dried up sponge? What happens if you wipe the surface as is? The sponge may crumble apart as you apply friction. So if you have chondromalacia, your kneecap cartilage is thinning or fraying due to misuse and disuse along the joint surfaces. The impact of stress and joint movement is so severe that you gotta do something about it. So you gotta perform this compression test on your kneecap, which is ultimately better if someone else is applying the force for you. So grab a buddy if you need one, but you can do this yourself. So we're gonna show you next. All right, we're back. So we're gonna talk about the compression stress test for your kneecap. You needed a direct force down. It's nice to have someone, like I said, but you don't need to have someone. You're gonna just put a lot of load that way. So you wanna put a lot of load, and then you're gonna tighten your quads like that. Now, after you tighten your quads, if you feel like a sharp pain, that's a pretty good positive, but even you might still have it because we're gonna try different angles. Now, if you see the kneecap, if this kneecap is over here facing you guys, the top of the kneecap, it's kind of got this like tip of the iceberg kind of like convexity here. You can tilt it this way to see if it's fraying on this side, or you can tilt it this way and it's going on this side. So I can also do that. And then I can kind of air on the inside and do the same thing. So you want to put a good amount of load. Obviously, if someone's there, they can put a good force. Yep, and then you're gonna go this way on the outside. And so there you go. If that's not an issue, then you're a negative test. But if it's like an ouch, or it feels like you want to tense up, or you're afraid to do that, that's no good. So you want to be able to create a compression. You could do it in a long sit position. It might be a little easier as well than in a chair, but I just wanted to show you guys this way. So on the side, it looks just like this. I basically press it down. I can do the inside, I can do the outside. So that's what it looks like. So here, and then I'm just creating a quad contraction. If that's happening, basically it's gonna take it, if it's like frayed, it's like sandpaper, it's just gonna go, and it's gonna hurt. So if you got that, then you have a problem. So that's basically what we have, and then it's a positive test. So now you know you have it. And even if you don't, you can try this exercise as well. It'll only clean up your motion and allow your kneecap to slide and glide like oil in water. This, like many of our cartilage solutions, is a very similar process. We gotta grind it out and sand it down like sandpaper. Let's show you how. All right, so here's the exercise portion. It's exactly the same as the test. So you just compress it. If you felt pain on the inside, you do it this way. Felt pain on the outside, you do it this way. But what you wanna do is just put pressure there, and you're just creating quad contractions until you sand it down and it feels smooth and there's no pain. I know it sounds counterintuitive, but like I said, you're gonna want to basically create that and do it until the stickiness or the pain or the discomfort stops. So once again, I put pressure here and right there, and you'll see that I'm just doing these quad contractions until it feels better. And you should check both sides, of course. So you gotta keep at it and do it until the pain or grinding stops. I know it sounds counterintuitive to put yourself in pain to get yourself out of pain, but give it a number of weeks and don't give up. Stay tuned for part 2 of this series to get the rest of my plan in a couple weeks. Let us know your thoughts on our video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Lin. Remember, we heal smarter, not harder.